What's up, everybody, and welcome. It's time to elevate and thrive, and we have a full house here at the studio today and an incredible show. Everyone, welcome.
Hi.
All right, we have the whole team here today. So my co-host, Dr. Angela's here, Dr. Anastasia's here, and Dr. Julianne. What's up, ladies?
What's up?
So we're talking skin today.
Yep.
Acne, health of skin. We got all kinds of cool stuff we're going to do. This is the skin episode.
Yes, it is. Yes, we're going to dive into it.
It's a big topic.
Yeah, it is a big
It's
topic.
a big topic.
It comes up a lot.
Yes, it does.
Well, yeah, and it's something that is incredibly important to people because it's your face, right? And it's so, it's what everybody sees when they look at you.
It's your money maker.
It is. For many people, it's what feels like your identity.
Yeah. Very true.
And so skincare and skin concerns, we've all had them, right? I mean, it's like everybody goes through stages, especially I think, when we hit those hormonal, like teenage years, that's when I think about my skin traumas, you know what I mean? It was just like, oh God, zits and like acne and stuff. But that can progress in life, right? And for many of us, we have skin issues. We can have skin issues our whole life and different things can cause them. So hopefully today we're going to get into a variety of different topics around skin care, skin health, and what maybe causes some of these problems that people have. Where do we want to start?
I think we had talked about beginning with acne because it's just such a big concern. We have a lot of people that come in for that, and Dr. Anastasia and I were talking beforehand that it can be difficult to treat, and it is actually more complex. Most people think, well, of course this is, it seems like it's very focal, it's localized, we should just be able to put something on it and then resolve it, right? But it's deeper than that. We really have to go into a lot of our, core systems like digestion and liver health and microbiome or, bacterial balance and we have to, and hormones, and we have to do all of that to actually truly get some long-term results. So it's a little complicated.
Yeah, and I think oftentimes with our patients, and we'll see the whole spectrum. I think last week I had someone that was 13, but I have women in their 50s that are still struggling with it. And sometimes people come in and they've already gone a more conventional route. And so they come in and they've been placed on, oral contraceptives, some form of hormone, spironolactone, sometimes antibiotics. Yeah. And sometimes it works, but the people don't feel quite right on those for the long term, or they don't work, right? And because those haven't really addressed the underlying issues.
I think the difference is we do get a lot of patients that come in and they say, I've had acne and it helped that I was on antibiotics for a little bit. And it's not a long-term fix. And I think a lot of the reasons why patients are interested in coming to see us as functional medicine doctors and naturopaths for skin health is because they don't understand why they've been placed on antibiotics. Why does it work? And I think that in itself is super empowering to understand, and just to understand what's going on in your body and why you've been given a certain treatment. And like Dr. Yeagley said, and Dr. Anastasia, I think we've said this multiple times in our videos and our podcasts. A lot of our treatments are multifaceted. It could be gut health. It could be hormonal. It could be stress. It could be what are you putting on your face or lack of what you're putting on your face. So
absolutely.
Where typically, where do we start then? I mean, because that can seem a little overwhelming, right? It's like, oh gosh, I have acne. I did this thing and it didn't really work, or I felt weird, and so I came here. And now you're telling me could be a variety of some kind of matrix of like 37 different things. Is there a typical starting place that we have for it?
I would say we probably begin with testing, right? Yeah. So, I think all of us probably, we begin with something because we know those core causes. So we say, okay, based on what you're telling me, we're going to start you maybe on a probiotic and we're going to give you some liver support. But in the just while we're starting to figure things out, because, we want to get into, if we can, definitely hormone levels. Even the basics are great, just through your standard lab, but sometimes we go deeper with the Dutch test to see androgen and estrogen balance. So androgen being like testosterones, or getting into, sometimes we'll do stool testing just to really see what those bacteria look like. And then I'll pass it on.
So I feel that, that's a great question. Where do we start? And I feel like when you sit down with the patient and spend some time talking with them, they will give us the clues on where to start, right? So they might come in for acne and you say like, well, how's your digestion? And they're like, oh, it's fine. You're like, well, let's dig into that a little bit deeper. And then you find out, oh, wow, like every time you have milk, you get diarrhea, or, you have all this bloating and, these issues. And that's not why they came in, but they're giving us a clue that, wow, your digestion is really off. And I've had several patients with SIBO, small intestinal bacterial overgrowth lately, that also have acne or rosacea. And there's a big connection with rosacea, which can show up like a form of acne. Sometimes it's just redness, but sometimes it has pustules, etc. And so they've they're like, oh, I never made that connection between my digestion and my skin.
Yeah.
So we're usually or they'll have irregular periods or heavy periods, right? So we'll get some clues on how to proceed, like what to do first.
Absolutely.
Or what medications have you been on? Like, have you been placed on oral contraception? Like all that stuff. And I think that's what gives us clues as to like what we test for, because these tests are expensive. And so I think we have to, medicine is, I always think of like my patients as like it's a fun little science experiment, but it can be really expensive. So we have to be mindful
and
of
overwhelming. To do everything at once can just be like, whoa. And
for sure. Yeah. And having too much information can also be overwhelming for the provider, but it can also just be like, well, now I'm treating too much. So, yeah.
And I do feel like all of us are pretty cautious with that. I think we're pretty mindful of, if there is something big we want to do, we pick that one thing that we feel like is most relevant and begin there. And, the thing that I love about our medicine too is that we do spend quite a bit of time like digging into that history. I think that's part of the beauty of functional and naturopathic medicine is that, we really dive into all those areas. It's not like just a quick 5-minute visit,
Yes, it's kind of like almost where we start is with asking the right questions and then using that to kind of hone in maybe on to the right testing and the kind of precision medicine so that we can really target for that particular individual, maybe what's going on in their specific case. Because there are so many tests and it can be fun, like from a kind of geek out perspective, like we get this test and try this out. But man, insurance doesn't cover a lot of those tests or partially covers them, and they can add up pretty quickly.
Yeah, it can.
Yeah. So I think one thing as far as, I guess, maybe diving into treatments maybe of acne, like...
Yeah, so we ask questions, we get some testing, we get a plan, and then, what's our treatment look like?
So treatment, again, complicated.
Warning, no easy answers.
Talk about different, like if we're going down the hormone path, what that looks like. If we're going down the gut path, what that looks like. We could maybe...
switch
talk about
because they're interrelated, but they're kind of like down to maybe the primary causative factor, right? So maybe we have the hormonal causative or the gut or the liver, whatever. So let's maybe go down a path and then we can kind of explore the other ones.
Okay, so I can tackle diet, many times, again, just if someone is on an inflammatory diet or if they are eating foods that are triggering for them, they may not directly see like, oh, when I eat pizza, like my skin breaks out. Maybe they do, but usually it's kind of like the overall underlying long-term kind of chronic response. And so we try really hard to encourage people to kind of move towards a more whole foods diet, so less processed, less sugar. Definitely sugar is so inflammatory, and get away from the top like food allergies, which would be like your gluten, dairy, soy, corn, and sometimes like nuts and citrus and eggs are at the top. But or we can test for that too, like to kind of narrow it down. And I would say like our testing, U.S. biotech testing, either the IgG or IgA, probably captures like 85% of things for people. That's just, I feel like, in my experience. But you can also do like what we call a dedicated elimination diet and take foods out that we know or tend to be inflammatory and then see what changes, right?
But you're going to need to have those foods out longer to see a difference in skin conditions than you are in maybe digestive health. Right?
Is the skin kind of like the last place it shows up a lot of times?
Longer turnover.
Great point.
So 3 weeks isn't going to cut it. Usually for skin, maybe a little bit.
Yeah. I think another thing that would maybe clue us to think about looking at gut health and food intolerances is it's usually the patient that says, and and I say this because I think a lot of people come in and they're like, I want to fix my skin, and have no idea that they're actually having gut issues. Some people don't realize that they're actually having loose stools. And some people think it's normal to poop every 3-4 days when really you should be pooping at least every day. And it'd be great if you could do it multiple times a day. And they need to be well formed and shaped like a banana. Some patients are like, yeah, I poop every day, but it splatters all over the toilet bowl. And they think that that's normal. No. And I always say, is it well shaped like a banana? Because most patients will be like, yeah, it's well shaped, but it's like kind of, sticky. Other questions like, does it float? Does it sink? Like, if it floats, then you're not really absorbing your fats as well. Is it like, are you leaving like residue, which is all really disgusting. I know.
We love talking about
poop.
We're poop specialists.
A lot of patients don't know that they're gassy. I don't know how many times I've asked my partner, like, are you gassy? And he's like, no. And I'm like, well, why are you farting all the time? Like, you're gassy. That's not normal. And this is disgusting, but like, does it smell? Like, does your gas smell? Or is it just like, airy and you just whatever, And like, there's definitely research that shows that with SIBO, if you're producing more methane producing bacteria, your gas smells. What type of bloating is it? Is it upper abdominal? Is it lower abdominal? And so knowing those questions makes us that helps us determine whether we want you to do an elimination diet, which we should just say like that's gold standard of like trying to treat food intolerances, because the food intolerance tests are great, but sometimes they are false. And it's because you have to be eating those foods to be able to develop or have antibodies to that. But I actually really love using the US Biotech or food intolerance test, because some people are allergic to things like, which is really sad, like broccoli and asparagus and garlic and onions. So it's really good for those people who have done the Whole30, who have eliminated dairy and gluten, corn, soy, alcohol, processed sugars, and they're like, I'm still bloated. And it's like, oh, because you're allergic to things that taste really good and are really good for you, but unfortunately you don't have, I don't know, the digestive enzymes to do that. And I feel really bad. Yesterday I had a patient who was allergic to bananas. I was like, oh, I'm so sorry.
Coffee and chocolate are the worst.
Yeah.
Avocados.
Oh my God.
That might be worse than coffee and chocolate. Yeah.
And
chocolate
make a really
worse.
good point too, because it's, as we're looking at the gut stuff, it's not always, I tell people, it's not about healthy versus unhealthy always. It's some of the stuff's obvious, like sugar or, a lot of like refined carbohydrates seem more obvious. But sometimes it's just what doesn't work for that person. So you don't want them to think like, okay, this is an unhealthy food. And, because they think they're doing really well. And then also with certain bacteria overgrowth in the gut, people are going to have a really intense reaction to certain foods, but it's not because they're allergic to it. It's because that food is feeding the bacteria overgrowth, right? And
so then I tell people, FODMAP diet.
Yeah. So I'll share a quick case study. So I just had a patient. I saw her yesterday. She came in for the acne rosacea. I've seen her before just for some general stuff. And she's like, I just can't take this acne anymore. I'm in my 40s. And it wasn't, terrible, but to her it probably felt terrible because she's been struggling with it, and so we tested her for gut stuff. She has small intestinal bacterial overgrowth. And so we went on this very long path of 4 months of diet changes, antimicrobials. She's like, oh my God, I didn't notice all my bloating and all of that stuff's way better in 2 months. And then her skin is about 50% better. So she's a little frustrated. She's like, I feel so much better. I feel so empowered. I feel like I fixed my gut. She had a zonulin of 600, which is a leaky gut marker that shouldn't really be over 100. Now it's down to 80. And she's like, I want it lower. I'm like, no, you're good. But she's on hormonal birth control. So we can't really check her hormones accurately. So now our next phase, now that the gut is fixed, is to start working on the hormones. And we sort of have to just do that by trial and error a little bit, because when people are on hormonal birth control, you can't really get accurate tests.
It's difficult.
So now we're on to phase 2. We're like halfway there, but it's not just one thing. So.
Yeah. And it's interesting after that long amount of time. And you said she is seeing differences in her skin at this point? Or?
Yeah, that's gotten better.
Okay.
And she came off a medication she was on at the same time, so there might have been a flare-up. But
Yeah. I know it's fascinating. And again, I think that what you're talking about is pretty typical, right? Unfortunately.
So
for skin.
Perfect storm.
Yeah, there's a lot of, I think that there have been underlying things going on for a long time usually. I do think sometimes it is a more immediate reaction, and if you can catch it quickly for people, or maybe it's an episode of stress, and therefore things are kind of not working as well, or they got a more acute infection. But yeah, I think otherwise we have to really dive into each of those areas. One thing I just want to mention, even though I think hydrochloric acid deficiency actually is another one that is pretty common. And we just make, we need it to digest and we make less as we age, especially if we have inflammation in the gut. And so it's going to allow, if it's there, it's going to allow like all of that overgrowth of yeast and bacteria, things like that. So a little piece of the puzzle that many times if we address it or catch it, it helps, right?
But it's not just with age, it's also with stress, right? So when you're stressed, you're in that sympathetic nervous system mode where you're running from a bear all the time. And so you're not producing the digestive enzymes that you need in order to digest your food. I think another thing is like if you're not mindfully eating, right? So if you're watching TV, if you're looking at a phone, I mean, we are guilty of that all the time. Not mindfully eating, like working and eating at the, So, and what that looks like is patients say, I feel like my food is stuck. Like when they eat something, they feel like it's stuck in my upper abdomen. And, we do HCL challenges, or you can get it in a capsule where you can challenge your body. And I've done this before. I'm sure you guys all have done this before. Where you take every meal, you increase one capsule of HCL, and you work up until you get to, and do not do it unless you're about to eat a large meal, or else you get really nauseous.
I was going to say, just to be clear, HCL is hydrochloric acid.
Yeah. Until you get abdominal burning. And I've had patients get all the way up to 10 plus, and they're like, nope, don't feel anything. It's like, wow.
I've had people get up to 26.
Yeah.
26 pills of hydrochloric acid.
Yeah.
And that was a person who actually had SIBO, parasites, and some other bacterial infection. It was like a perfect storm of, destruction.
Things have just been kind of shut down.
Yeah.
So the gut's really important. Another thing we didn't bring up, the one thing we love to talk about, though, genetics.
Yes.
And, sometimes people have different genetic variants or different genetic predispositions that are going to leave them more susceptible to acne, either because they don't methylate well, so they don't detoxify well, or they don't break down estrogen well or androgens well. And so that's kind of that, that unfair part of the
genetic lottery.
The genetic lottery, where it's like, okay, why is it that, some teenagers just can eat all the crap they want, right? Pardon my French, but they can get away with it, and they're eating like dicks and fries and pizza and sugar and ice cream. And then there's the kid who eats just,
super clean.
Eats pretty clean, or tries to eat that way and can't, right? And it's like, there's not necessarily, certainly we can support those pathways if we can identify them, but there's not always like an easy bypass. Sometimes it's just like, it's your lot in life. You don't, it's like, you don't get to be the man who lives to 110 who smokes a cigar and has whiskey every night. Right. Like, it's
the
like,
George Burns Constitution. Yeah.
What is it called?
George Burns Constitution, right? Or constitutional
and so
tank.
we can look at that, and that can also guide us supporting detoxification. And
I would say the ones that we like, I think we recommend Strategene quite a bit for that genetic overview, and sometimes some others that probably, if we have to, might not mention it because we don't prefer them, I think. But we can also do dedicated like MTHFR, COMT through our lab here as well, if that's,
It seems like it just seems like something that everybody should have done along the way.
I think so.
Maybe not early on, but at some point you should get it done, I think.
Yeah, it's good to know what your kind of risk markers are.
It just seems like there's so many things that kind of flow from that. We've talked a lot about even like kind of a vitamin-based genetic profiling as well, too. And so we're talking about supplementation dialed in, as well as like diet, and then some of these other pathways. All of it is great information to have. And if you don't have it, you can make things harder than they need to be.
Yeah, it can be like a preemptive.
Yeah, preemptive
sort of
kind of,
guidelines.
Yeah. So other kinds of treatments that we look at then, so we talked kind of about kind of going down the hormone path. We talked about the gut. You've brought up a few times liver. I mean, is there some stuff we do around liver support and around that kind of detoxification pathways that we like to do?
Yeah, I mean, we definitely have a lot of herbs that we reach for in that way. I would say milk thistle is a really good one. That's very gentle, very well tolerated. And then we have some really good combination ones with, dandelion and also looking at some of the bitter herbs like the combinations, as well as thinking about moving things, helping the liver move things, maybe with sauna, right, and then other things that help to balance the hormones as well.
The reason why we look into liver, so naturopathically, we think of the liver, well, we look at all of our emunctory systems, right? So those are our detox pathways. A lot of people forget that your skin is actually your biggest detox organ. So when things do show up in your skin, that means you're detoxing really, really hard. Other ones are liver, kidneys, lymphatics, and your gut. So
colon, yeah.
Which we talked about the gut. And so liver is like a huge detox organ. So supporting the liver also takes off the stress on all the other emunctory or detox pathways. So that's, I think, another reason why we look at the liver. And there's a lot of like big detox pathways like phase 1 and phase 2 liver detox pathways that we look into, which is, I think, one of the reasons why we're like, okay, let's support your liver, whether it's herbs, whether it's glutathione, whether it's, I mean, we can talk a ton about vitamins. We can have an entire episode on phase 1 and phase 2 detoxification. But yeah, that's why we look at the liver.
And then a couple of my favorites are amino acids or nutraceuticals like NAC. So NAC has actually been shown, N-acetylcysteine, so it helps support glutathione production. And it actually has been shown to lower androgens. So if men or women have excess DHEA or testosterone, which can trigger acne, NAC is really helpful for that. And then DIM or indole-3-carbinol are nutrients that they're derived from like broccoli and those cruciferous veggies, but you have to eat a lot of them to get that much. And those are fantastic for helping to detoxify excess estrogens. So,
do we do any of those in IV form too, or are those mostly?
I wish.
I mean, glutathione definitely,
is a push,
is great for the liver. Yeah, and I mean, you can do NAC, but we don't here, but it is available. The rest of them, at some point they had those available, but they're not really accessible now.
Another big one though that can be done IV, but also orally is choline. And choline's critical for liver health. And a lot of people have a PEMT gene, which impairs their use of choline, which is, basically what the healthy liver cells are composed of, and healthy brain cells. So choline's one I sometimes forget about, but
it's fantastic.
It's really important.
Yeah, I haven't heard that come up too much in conversation, choline, before.
Yeah, so there's a genetic marker for it, and it's really important for cognitive function, preventing Alzheimer's, and detox. So
yeah, it's pretty incredible. I think we probably reach for it more for brain, so for kind of like or mold toxicity, maybe not as much like in this area, but if we were seeing all of those things, I think if we were seeing brain issue, cognitive issues as well as matching with the detox issue, it would make sense, to do it. I know I already said this, but I'm a huge fan of sauna, the infrared sauna, because I feel like it does, it really does help the lymph system, helps the liver, and we're using the skin to kind of
opens up
excrete.
Blockages, so.
Exactly. Yeah.
I guess another thing is this liver also helps balance your hormones. So we didn't really talk about the details.
So that's right.
Supporting the liver is great, and root cause might be hormones, might be, other blocked detox pathways. But so hormones can play a huge part in acne, in that maybe you're making too much androgens or testosterone, right? Or you have too much estrogen. And that's when like testing comes in. I love the Dutch test because it helps me see those genetic SNPs. It helps me see estrogen metabolites. metabolites, and then kind of see like what the balance is of your estrogen metabolites, what your deficiencies are in certain organic acids. So then I know specifically which pathways I need, whether it's phase 1 or phase 2 detoxification to support, or whether I need to help this person methylate or, increase their activity of COMT, or if they're just so stressed out. So yeah.
Definitely happens these days.
Yeah.
What about topicals, I guess, too? I mean, that's because I think that's maybe the obvious place people start, So we just went on this long journey of, a very interesting journey. And I think one that's both complex and insightful of all the internal workings and the way kind of our bodies, synergize that then produces this problem on the surface where a lot of us say, oh, I have a skin issue and I reach for some kind of a topical solution to put on it, right? But there are some topical stuff that we would also look at as part of the solution. So what kind of from our perspective do we look at when we think about topicals or like skin treatments?
I probably a pretty simple one would be tea tree, which is pretty common out there. They have some really nice like tea tree, astringent wipes that I think are really good. It's kind of a very easy recommendation. I do end up also using like prescription azelaic acid, which is kind of an extract of vitamin C. It can be effective, but sometimes it's drying, and so not everybody likes it. But it can, because it actually will help, to heal the skin as well as like kill the infection that tends to be, you tend to have those little pustules or little pockets of, infection basically. So it helps to kill that. Other topicals that you really like?
I feel like find out what people are currently using, because I think oftentimes people will get this protocol that's almost like they're doing too much to their skin. Like they're using these really drying cleansers and they're scrubbing it really hard, and they're not using, they're trying, oftentimes people will have oilier skin and they're basically stripping their skin of all the oils in the body, or the skin is often going to sort of overreact and start producing even more oil. And so they get kind of locked into this thing where they're drying it out and then they're producing oil. And so I think going with really very, very gentle, natural, doesn't, without all of the parabens and without all of the chemicals, and just trying to keep it really, really simple. I love sea buckthorn oil, and people think like, oh, I don't want to put oil on acne skin, and sea buckthorn oil is amazing. It hydrates it, but usually people's skin improves quite a bit with it.
That's true. I had forgotten about that one. Cebu, we call it Cebu. It's really quite good. It's nice.
And people are surprised because they're like, oh my God, like it's oil and it's actually, my skin's so much better. And so I think just not doing a lot of caustic things to it, where it's constantly being irritated. And
it's almost anti-intuitive kind of. You think I want to, it's like I want to kind of take the war to my skin and just eradicate this acne, and you kind of you're really prescribing maybe a more gentle approach.
Mm-hmm. I had learned this from an esthetician for spot treatment, which was tea tree oil. So she just mixes like a little bit of tea tree oil with just any other carrier oil that you're not allergic to, and just like leaves a little bit overnight to an area that has acne. She also said you could use a little bit of hydrogen peroxide too, but obviously dilute it with some water so it's not so strong. But that has actually worked really, really well. I'm not a big fan of telling patients to put a ton of stuff on their face. I had also learned this from the same esthetician, is that like when you put a ton of product on your face, one, you can like have your skin react, but two, it's one, clogging your pores, and then you're not really absorbing all that stuff on your skin, because it's just like layers and layers and layers of skin stuff. Also, women, clean your makeup brushes and your sponges at least once a week. It's disgusting. It's disgusting. It is.
And actually, you're supposed to replace your makeup. I don't think everybody does this. Like every 30 days, you're supposed to replace your makeup. You just kind of like keep going and going.
That sounds a little bit like a marketing play from a makeup company.
I was like, if you
everybody,
brushes,
here's the thing: that makeup looks mighty fine, but every 30 days you get brand new.
And then, of course, seems like a good opportunity to talk about a newer treatment that we're offering at the clinic, Dr. Dr. Yeagley.
Yes, we're super excited. So, we now have the Potenza Microneedling device. And so what's really interesting about this one is that it works on, we can use it just with the microneedling. We can add PRP, which is regenerative, but really helps to stimulate collagen and elastin in the skin. But what's cool is that it also has an acne tip. That can be specifically, it's really more for kind of the deeper cystic acne that you can zap it and get it to go away. And it should just take a couple of days, which is interesting. So for kind of like if you're the person that has the dedicated deep cystic acne, that would be like the tip for you to go in and just specifically get that. But if it's the overall, like you have acne scarring, actually it can be really nice within just a few treatments of really smoothing out and making that skin look, definitely reducing like the presence of acne scars. So I'm excited about that. Yeah, that offering.
Yeah, no, that's fantastic. That's what I thought with the Potenza was like, maybe some spot treatment for some specific stuff, and then the acne scarring would be the other great way to look at that. So, after we get it all resolved, if there's some lingering skin damage, the Potenza could help with that.
Yeah. Or we could do it, at the same time while you're working on things, right? So
how have you been feeling with your treatments?
Man, I got to save that for our follow-up Potenza issue because I just had my second treatment and it was the intensity went up. So it was a lot to talk about on that.
I didn't hear you screaming.
I didn't. I'm very stoic when I go through the thing. I just because remember I have a lot of tattoos. I did a lot of tattooing in my life, and so I just put myself in the zone, and I was just like, bring it on, keep the needles coming. I'm good to go. Just.
Let's not scare our listeners. We do numb your face if you'd like to.
We do numb
it's
the
very,
face.
It's very painless. Very little pain.
Yeah.
I'd say mild discomfort, but it's very, very light. Any other kind of wrap-up thoughts, just rando side, because I think we covered a lot of stuff. And if I were to summarize, I would say when you have an acne issue, good news is we can help. We can figure it out. Depending on your specific case, it might be an easy answer or it might be a little bit more complicated answer, but the good news is we're here to help you figure it out, and we're there to take that journey with you. And sometimes, as that case study that you talked about, it can be a multi-phased approach where we have to kind of fix multiple systems along the way, which, that's going to take care of the acne, but it's also going to help in all these other areas of your life too. So I think the other side of that is if you do have a more complicated situation with acne, when we're addressing those other things, you're going to get all this other spillover benefit that's actually, in many ways, probably better than the acne resolution, right?
Absolutely, and people will report that. They're like, "Wow, my energy is so much better, and my
energy, my sleep,
definitely the
mood."
gut. Yep. Yes, yeah.
I love it. So if you have an issue, we're here for you. Come on in. We'll figure it out. We'll start with the questions to kind of determine where we need to go, and then we'll kind of get you on a personalized path to get there.
Fantastic.
I think that's it.
Good.
Yeah, I think we did it.
Awesome.
Yeah.
Thank you guys for being here. Thanks for shedding a light on this. It's a huge issue for people who have it, and some of those things where you can start to get to a spot where you feel a little hopeless and frustrated. You don't want you to take care of. So come in and see us if this is an issue. Until next time, thanks for being here. We'll chat later.
Okay, thanks. Bye.